Joining us, so people don't have access to water. How are they coping?
Good afternoon to you and our viewers. Indeed, we're here in Mahikeng Township in Swaziland in Northwest. Here in this community, many have complained about, unreliable source of water. They say that, they have gone for at least about 4 days this week without water. They say they last received water on Sunday, and the latest delivery of water came in just this afternoon. They say that this has made all attempts to adhere to the lockdown stipulations very difficult. I'll just step out of frame here and you'll see that they are not observing the social distancing that has been set out, and they say it is very difficult to do that because they need to continuously come out to this water tank and try access the little bit of water that they can. Speaking to them there about what challenges are also emanating from this, they talk about health issues because without proper running water, sanitation in itself becomes a challenge. They're actually forced to use the bush just behind these buildings here to relieve themselves whenever nature calls. It is clear that with this situation, many in communities such as this will actually find it very difficult to maintain the hygiene standards that have been requested. But for context about how big this challenge is, I'm going to speak to a local resident here. Ntate, how can katumela le kae ntate wa me? Re siame. A go re tlhalosetse papa gore kgang ya metsi ke sebaka se se kae tsa majana le gore le khona jang mogolo wa ka?
Kgang ya metsi ke bothata ka gore ke nako e telele re sa nna metsi, re sokola ka metsi. Lori e tla gangwe mo bekeng for di hele beke e tla gangwe hela gape bya go tla gape tsa di latela.
Ntate wa ka go tswile taelo ya gore lockdown gore batho ba nne ko lapeng ba ske ba kokwana, mme ga motho a hitlaga o hitlela baagi ba kokwane mo metsing mo le khona jang gore le netehatse gore ga le ipe mo kotsing ya go hitlela botlhoko bo ba corona.
Ga gona gore re ka ipa gore ka moghomo ka gore re sena metsi tshwantse re kry metsi, ene tanka ya rona ga e kurumele go godimo mara ga re tshabe corona. A ka la re ke corona la re ke
corona
ya ba ka ya bankanya go pele ke corona ya ha tanka e le uopuana e sa tswadi e sena metsi gore e na le metsi mo teng e sa tswadi a corona ga e tsene
gwa tetsa maaka mathe a motho ntate. So ga go ntse jalo ga ra tshwana gore re be re kokwane mo lefelong le le lengwe.
Ya no wa itse ke yang gore a se gore ke a go bua ka moghomo gore ke e baya batho ba re diletseng go pele ba re dira di hema ka gore ana re tshwantse re dulela kha re sa itse gore ra kae ga re shebile di TV ga rena next ke sala ke tsena kha ka 2002 ngwana ke wa bobedi one ke tsena ka ene mo o bile ke monna la go godile e bile ke tswalla ka mara ga gona sepe se se direga go simologile 6 ya re 9 ya re 8 ya re 9 ba bona di tlhabolo go dikwa rona re beilwela ka.
What he's explaining there to us is that as a member of this community, he feels that their section has been sidelined from developments. They have been struggling without water for a long time, and now that the corona pandemic has hit, it makes them, feel even worse off than before, because at this present moment, they've got no other choice but to gather in this manner to access the base essential water that they can. To also contextualize on how big this problem is, we're also going to speak to one of the community leaders. You must remember that it is in this very community that President Cyril Ramaphosa made a commitment that this would be used as a pilot project to ensure that all households are equipped with running water. And thank you very much for your time. Speaking about the promises that have been made, what do you make? It's been a while and more problems are emerging.
Yeah, you remember after the by-election, the president came here and made a promise that we are going to have a running water in Mamusa. And currently there are only 2 wards that they are having water on their taps, which is Ward 2 and Ward 4. But all other 7 wards, there is no running water. And now it is a problem because the people in this area, they only receive water once in a week. And we have this pandemic that we're supposed to fight, which is corona. So they are unable to fight that pandemic, precisely because we are saying they must practice hygiene. And we come challenge to them to practice hygiene without water. They don't even have a pit toilet, they don't even have a flushing toilet. If they want to go for a toilet, they must go to the field. And that is also a challenge to them. They don't even have electricity. So we ask yourself, actually, what is that our government is intending to do with our people? That means these people, they are vulnerable and they can easily be exposed to corona. And corona is a disease that kills people. It's a virus that kills people.
Now, upon my arrival in this community, I see a number of water tanks. Are these pre-existing water tanks? And if they are, have you received any of the water tanks that have been promised by the national government?
Actually, the water tanks that we are having locally here are not sufficient enough. And you'll understand that those water tanks, they only receive water once in a week. That simply says that also the trucks, they are not sufficient. You'll remember the minister also indicated that they've bought 41,000 water tanks, and it became the responsibility of the municipality to make a requisition to the office of the minister to supply tanks locally here. But our municipality have not yet done that thing. Actually, as a community, we need more tanks, more trucks, and also our dam that is supplying this municipality with water. It is full. So the only thing they must do, they must open the taps. You remember the MEC once said after the election they are going to open the valves that were closed before the election. So those valves are not yet open because some of the taps, they don't receive water. So that is the challenge that we have. We have a general challenge of water in municipality, and having a general challenge of water, it becomes difficult for us to advocate and to fight coronavirus.
Thank you very much for your time. And the question from that statement is, how do you prevent corona with no water? With that sentiment, back to you in studio.
Thanks very much, Sentleeng, for that report. Well, if you were a passenger on the cruise liner MSC Orchestra that sailed from Durban to the Portuguese islands in late February, well, the health department is looking for you. 2 people on board the ship tested positive for COVID-19. The MSC Orchestra left Durban on the 28th of February for the Portuguese islands and returned back on the 2nd of March. Authorities are also trying to trace passengers who were on board a second cruise on the same vessel from the 13th to the 16th of March. Health Minister Sentleeng Lehihi says all passengers are considered contacts of the 2 COVID-19 cases and must make contact with the health departments in KwaZulu-Natal and the Free State. We're going to go for a quick break. We'll have your market news thereafter.